All right, guys. Hey, thanks for being on today. We are going to be talking about HIDE and FIDE DSNPs, duals, Medicare, Medicaid. Some of you guys may be in those HIDE, FIDE states. Some of you all may not. I'm a little confused with this. So we have two guests today, Roel from United Healthcare, Jeremy from Senior Market Advisors, going to give us some intel. And then Jeremy, man, you kind of I like what you did on Sunfire, man. If you could repeat that at the end once we get some good HIDE FIDE knowledge so we understand what you showed on Sunfire.
Let's do it.
Okay, perfect. All right, Roel, this is all yours, man.
Okay. Well, thank you everybody for joining today. So just really quickly wanted to introduce myself for those of you I haven't met. So my name is Roel Garces. I'm the Market Growth Manager for United Healthcare here in the San Antonio and Corpus markets. Real quick, I will show you a map of the territory that we have. So with my director, it's called Central Texas. It basically extends as far north as Waco, Austin, San Antonio, then Corpus. So it's like a nice little oval down the center of Central Texas. So that'll be the area that I'm in charge in. But I will talk a little bit about just Texas in general and how we are a unique state. There's a lot of different plans and areas, and between the HIDE and FIDE, we'll kind of talk about the differences and then how it relates to our dual special need population and what the sales opportunities are for you guys. So a lot of content, but I think it's going to be good, and we'll dive right in here.
And Roel,
So
with
yes.
HIDE FIDE Texas, and I know you're talking about that, will those rules be applicable to other HIDE FIDE states? Because we do have people here from all over the country.
Um, for the most part, yes. Yes, for the most part. Now, every state is specific, and of course, they have their own rules. But the main idea, the main rules will apply.
Okay.
Absolutely.
Okay,
Yep.
perfect. So
And
you
I'll,
guys
and
that are not
we'll,
in Texas, hang in here, guys.
yeah, yeah. And it's going to be a good baseline for Roel to cover Texas. And I'll cover the other states as well when I do the Sunfire portion as well. I'm going to put the map in the chat right now just so y'all can see, okay, Texas, cool. That's great. What other states are eligible?
Yeah,
Okay.
absolutely. And so let me just start off. I'll show you the area that we're in. Um, Hopefully we can see that. Let me see if I can blow it up a little bit more.
We can. Perfect.
Okay, so Central Texas is where I'm at. You can see yellow, orange, light green, and dark green. And really, again, this is going to be the areas I talked about. So I'm more in charge of the San Antonio and Corpus markets, but we do have, again, Waco and Austin right above us. And so you can see where that is on a map. That's just a little bit of, background knowledge so you can see exactly where we're at. So let's jump in. So FIDE and HIDE SNPs, right? We're going to talk about how DSNP plans are designated and really what these two mean, what the differences are. So, right, a lot of new terminology towards the middle and end of last year, and then the beginning of this year. We started seeing these terms floating around, right, and being put in our daily usage. So really, let's break that first one down. Okay, so we're going to look at the HIDE plan. What this is a plan, the DSNP in general. First of all, this is for someone who has both Medicare and Medicaid. So you probably know this already. They're called dual eligible consumers or just dual eligibles, right? Well, what the HIDE plan does, this is a Medicare Advantage product that is combined together, and it's coordinated with Medicaid, right? So what happens is it shares transition data with the state or the Medicaid plan. Whenever you have these high risk full dual recipients, when they're admitted to the hospital or to a skilled nursing facility, right? So this is like more on the coordination side that we're talking about. This whole idea process. These two different plans are really about the coordination of the care. Now, we talked about different states earlier. So the state is going to define the care transitions of what, specifics on the data, but pretty much they're going to work the same way. And, CMS is always going to be the primary authority of this type of plan. Okay. So just really quickly, some attributes of the HIDE plan that you'll see. And once again, let me break down the acronym. But HIDE stands for Highly Integrated Dual Special Need Plan. Okay. Or Highly Integrated Dual Eligible Special Needs Plan. Okay. So when you see that, that's what it means. Just think of the first two letters, highly integrated. You'll start to know the difference. And then when we go to the FIDE side, that is fully integrated, right? So there's the two differences there. But this type of plan, again, it's a Medicare Advantage product that's coupled together, with that at-risk Medicaid contract, and it really provides either behavioral health and or long-term services and support together, right? So that is really one of the big focuses of the HIDE special need plan. So you have the DSNP and the Medicaid Managed Care Organization, or also called the MCO, right? And these must be owned by the same parent company. For example, right now, United Healthcare is one of 3 MCOs within the San Antonio market. So what that means, we won the bid to be that Medicaid provider. We outbid Amerigroup and Superior. So right now there's only 3. There's Community First, there's Molina, and then there's United Healthcare. To be honest with you, we're really only down to 2 because Community First didn't file their HIDE this year. So they still have it, but this year it's really only Molina and United Healthcare. So just wanted to point that out for anybody doing business in Texas, in the San Antonio market, more of a selling opportunity for you with the United Healthcare side.
Hey, Roy, I want to ask a question here, man. And then maybe this is more for you, Jeremy. Agents that are outside of this market where Roel is talking about, if they want to find out, like I'm glad you just mentioned, at least in my area, the MCO carriers. How does an agent find out what MCO carriers are available in that area where the senior lives in?
I can take that one. So yeah, Texas is pretty simple. We're going straight to the source with Roel. Sunfire is going to be gospel when it comes to searching MCOs. There's about 20 states I put in the chat that are HIDE FIDE, from Arizona to Washington. There's some holes in between, but about half of the states are going to be HIDE FIDE. So Tennessee, Kentucky, Texas, Florida, California, Arizona, New Mexico, stuff like that. So you can learn the 3 to 6 MCOs for each of those states. The quickest way for you to do that is through Sunfire, which I can run through at the end of this presentation.
Perfect. Thank you.
Call out. Yeah, definitely good questions for those doing multiple states. I know our headquarters state, Minnesota, is also one of those because some of our PowerPoint slides have FIDE information for Minnesota. So that's also one. And towards the end, I do have a map and a chart that's going to show us a little bit more of a breakdown on counties, at least within Texas, but something else you can kind of use for help. Maybe not directly showing you the MCOs, but let's say you're interested in United Healthcare and what if there's any highly integrated special needs plans available in other states. We've got a tool on Jarvis called the Medicare Product Portal, which basically you can see a full map of the United States, click on any state that you see, and you can check the DSNP plan availability there, and it'll tell you right away. Okay, for example, let's say you pick Tennessee. Well, if there's one there, it'll show you, yes, there is a HIDE plan with United Healthcare in that state. So I'll show you more on that. Again, a little more of a specific carve out, but that can be a helpful tool if you're looking for what states have a HIDE with UHC.
Okay. What was the name of that tool, Roel? I'm on here right now.
Okay. Yes, it's called the Medicare Product Portal. So the way you would find it, and I have a a slide coming up and I
Oh,
can
okay,
run through.
perfect.
But
Okay,
yeah,
we'll wait
it's
for
if
that.
you can find it in the Knowledge Center. If you click on the Knowledge Center, it'll show up as a link. Yeah, we'll go through that here in just a sec.
Okay, perfect. Thank
I
you.
just wanted to give you the characteristics of the FIDE so you can see on the same page here. So on the fully integrated side, right, you're going to see um, there's a couple things that, some characteristics that they might share, of course, starting from the bottom up, right? The DSNP and Medicaid MCO must be the same legal entity. So again, have to be owned by the same parent company. But one of the main differences on the FIDE, you know, the Medicare Advantage is integrated with more coverage toward the skilled nursing facility, right? So this is coupled with that Medicaid contract and an inclusive um, benefit of at least 180 days in skilled nursing. And then there is behavioral health that is also required unless carved out by the state. So really you see the two big differences on that side. The long-term care services and support would be on the HIDE side. Skilled nursing is more on the FIDE, right? And so um, just right off the top, kind of a high level, those are the two things. Again, when we talk about integration, when we talk about coordination, you all probably know this, but the idea is whenever you have two different companies that are dealing with a member's care, for example, a Medicare Advantage with company A and the state benefit Medicaid or long-term care with company B. The experience has been very fragmented for the member. So when they're trying to get authorizations for a specialist or for a procedure in the hospital, right? These are things that these members rely on, right? But when there's two separate companies, it goes back and forth so often that the member really has a very difficult time. And so one side is saying, no, you have to talk to Medicaid. No, you have to talk to the Medicare Advantage side. And it takes a long time. Some things don't get paid. Some things just keep going around in a circle. So, these are individuals that have a very specific, just condition or life situation, right? They're, dealing with, very low income, a lot of them disabilities, a lot of them chronic conditions, a lot of them different types of food and financial insecurity. So you can see where that would be difficult. But with the coordination with these two, it really puts everything under the same parent. So now you have essentially the left hand talking to the right hand, and that's where it really streamlines the experience for the member. So that is our goal with our Heidi plan.
All
And
right.
let's go on
Before
to
you go on, because we do have some
yeah,
new agents, can you go right back to that
okay,
slide, please?
sure. If anybody wants to take a picture, of course, you're welcome to do so on these slides.
Will you explain, because we have new agents, I mean, I understand this, I think, the difference between long-term services and support and skilled nursing, because those are two different things.
Yeah, absolutely. So, okay, let's take long-term care, for example. First of all, this is going to be, um, okay, let's see, how can I put this? Your long-term care services are things like, somebody living at home and they're dealing with a disability. And that's specifically for like our Star Plus is what we call that here in the state of Texas. So somebody with disabilities. So whether that be, physical, mental, they're living at home and they have these situations, these obstacles, right? They can't walk. They're dealing with, you know, um, maybe they have wheelchair ramps at the house. They have, mobility issues, all of those types of things. So that would be more on the long-term care. This is when someone has like a provider to come and help them at the house, do cooking and cleaning, moving around, even showering, basic daily things like that. So that would be more on the long-term care side. And then, of course, your skilled nursing. This is when you are physically at an offsite facility that is, aided by nurses, and so they're doing more like, being with that individual, checking their, helping them move from their hospital bed, their vitals, their daily medication, things like that. So if they're confined to that nursing facility, it would be a completely separate coverage. So one is at the home, one is again at the facility itself. I think that's probably the biggest way to differentiate the two. Does that make sense?
It does, and like what I've seen here is on the long-term care, these people have a set amount of hours that they can utilize for a home health care provider to come in
Mhm.
and help out. And I
Absolutely.
also
Oh
look
yeah.
at it as non-medical. Like they're not doing medical stuff. They're just helping around the house, cooking, cleaning, that kind of stuff, where the skilled nursing is very more oriented to medical.
To the health side. Exactly. Exactly.
Okay.
Um, okay, so I wanted to go over this slide in particular because I mentioned earlier that, we're talking about Texas and a little bit more on where my area is focused. But here in the Central Texas region, we only have a HIDE. So I've explained, the differences, but you'll see that the FIDE and the coordination only are sort of grayed out. And I just wanted to show you that slide in case, again, anybody working in these specific areas, that way you can know for sure. We only have the HIDE here in the San Antonio, Austin, and Waco markets, and that's very specific. So just to keep in mind, if you're doing that, that's what we're talking about. Um, but on the DSNP side, right, you can see here. So some of the things uh, for the DSNP, it continues to provide Medicare services. We have the services, like we mentioned, for the long-term care support, behavioral health. The cost share is added onto that depending on the type of integration. Um, and then on the Heidi side, since I mentioned it can be one or the other or both, behavioral health and or the long-term care services and support, right? You'll see that. And then again, for 2025, this year, as we mentioned, one of the rules is it has to be within the service area. So the plan has to be within the service area of where the behavioral health and long-term care is offered as well. So just keep that in mind. They're making it, in the same service area, so you will never have a gap. Or, well, we have this plan here, but the long-term care service is in another area. It'll never work like that to keep, the member getting that support they need, getting those benefits, and it's right there in the same service area. So I just wanted to show you this slide really quickly. And
Can you
again, yeah.
explain, Roel, that the
Mhm.
bottom of these two on the DSNP and the Heidi, the highly integrated plan, the blue and the yellow, the bottom you have SEP eligible limited, and on the Heidi you have SEP eligible ending in yes.
Sure, absolutely. And some of the slides coming up are going to go into more detail on that,
Okay.
but I'll explain it really quickly so that way you can see it. So for those of you that might be new to Medicare or just to that term SEP, right? So that stands for Special Election Period. And you guys might know that anytime you're dealing with Medicare, you're always looking for these specific windows throughout the year where someone can enroll, right? So you've heard the term AEP that we just finished last October through December, and then again we just finished this big portion of OEP, which was uh, February or excuse me January through March 31st, and then now we have this rest of the year between April and the end of September. So because Medicare has specific rules and there's these windows that everyone is looking for, like how can I enroll someone? Do they have the right time, depending on their situation with this window? Is a window open for them? Well, on the Heidi that we have on basically, the ones here in Texas, there is a special SEP if someone qualifies for the Heidi plan. And we'll go through that. So basically, they meet qualification, they meet the right criteria, and you can enroll them. And we'll kind of go over what they are, but just briefly, kind of high level. It means they have, you know, obviously the red, white, and blue Medicare. They have to have the state Medicaid, and it has to be in the Star Plus side. And then there's specific, again, we'll talk about Star Plus and the meaning, but basically back to they qualify for the long-term care side, right? There are specific levels of the Medicaid considered to be full dual, and those have to be met as well in order to use the integrated SEP for the HIDE plan. So we'll talk about that. But basically, that SEP eligible down on the bottom that you see, it really just means specific criteria has to be met. You know, and we'll talk about what those are coming up. Yes. All right. So let's go forward here. So I wanted to just talk about again why offering the HIDE and the FIDE itself, right? What are the main benefits? So, you know, we talked about it. HIDE is going to serve that low income, high risk population. You know, it really helps the integration be the coordination of the care be so seamless, right? And not have the member kind of flip-flopping between decisions and getting the care that they need. Okay, so it definitely aligns again with giving that long-term care support, the behavioral health, and really just making the overall experience and the health outcome for the member that much better. Okay, so that is our focus for why we offer a HIDE here. So let me talk to you a little bit about the HIDE and FIDE population, right? What are some of the characteristics? How do you identify what would be a good fit? And so this is a really good slide. If anyone wants to take a picture once all the columns are populated, you're welcome to do so. So first, we start off with this individual whose name is Tom, and we're going to see that he is qualifying for a FIDE. Okay, and so what are the differences here? What are the characteristics? So Tom lives in the community. He lives in his home. He does have diabetes, but it is stable. He also has another chronic condition, chronic obstructive pulmonary, right? So he's dealing with that as well. Now, Tom's goal is he wants to remain in his home and, you know, obviously keeping his health as high as possible. You can see his challenges, multiple health insurance cards, has limited support, right? Okay, so let's look at another example. So now we have Mabel. She's a little older. She lives in a nursing facility. So if you think back to one of the FIDE criteria or one of the benefits that it offers, it talks about that skilled nursing facility benefit, right? So Mabel lives in a nursing facility. She's dealing with a couple of issues. You can see Parkinson's, dementia, and vascular disease. She does see her family often, or excuse me, her goal is to see her family often, to be active. But the challenge there is, you know, she doesn't really benefit from any cost saving. Doesn't really have, you know, anything in the plan for just minimizing the decline of her health as things progress. So both these individuals here, you know, they're qualifying more towards the FIDE side. And then we have Janet. So Janet, she lives in an assisted living facility. So that's a little different, right? They have more, you know, they're not so heavily monitored. They don't have round the clock 24-hour nurses going back in. It's basically like their own apartment, their own area they can live, but they do have some a coordination team there on hand to help with things, right? With medical issues. So she's got a physical disability and she's had some strokes, wants to remain in her home. She wants to avoid, you know, health complications. And then the challenge here, very little assistance from her family. And then she receives these complex services that are often uncoordinated. So again, we talk about the coordination. We talk about, you know, the fact that she's in that assisted living. So you can just kind of see some of the differences in how each of these fit that profile. So again, you're welcome to take this picture to see really and have it as a reference. Okay, I want to show you one more. This is going to be regarding the way members benefit from each of the plans, right? How do the members benefit from a FIDE, from a HIDE special need plan? So from this integrated model approach, you know, the long-term care support team, that's really like basically the quarterbacks. These are the quarterbacks of, these individuals, health outcomes. So they can focus on, person-centered care without, the difficulty of figuring out the assessments and things like that. So they have a dedicated team that will, make sure that they're working towards this goal together. And then, the core long-term care service case management, they really, have teams that they're supported by these disease management nurses, other nurse practitioners, behavioral health specialties, social workers. So they have really great support behind them as well. So you can see again some of the things that members would have to deal with more than often is just these complex assessments, in the home. But the two plants really take care of that. They really gravitate toward this coordination. Things as far as like diabetic, preventive care, chronic condition management. I mean, the list goes on, right? So just wanted to show you how these systems work together and how they really help improving the quality of life for the member. Okay, so one other thing here, I just want to talk real quick. How are we doing on time? We okay so far, Luis and
Yeah, we're
Jeremy?
good. No worries. No,
Okay.
we're plenty of time.
Okay. So I want to move on to a little bit about the dual eligible consumer and just again how the HIDE and FIDEs relate in that space. In the context of, again, we'll talk more about those SEP windows, right? We'll talk more about the criteria, but just wanted to give you a kind of a ground up start on our DSNP demographic. So just want to share some statistics with you really quick. If you look at the far right-hand side, right? So these are things that our DSNP population deals with on a daily basis. So 42% are disabled. These are, again, your dual eligibles, people with Medicare, Medicaid. 42% of them are disabled. 17% have Alzheimer's or related dementia, right? 41% have at least, one mental illness they're dealing with. I'm kind of going in a clockwise circle, but 12%, they're up there in age, 85 years or older. 45% have three or more chronic conditions. So just think about that again for a moment, right? That's a lot to deal with. And then, 27 use these long-term care or institutional type of benefit. So we already know they're low income. So on top of dealing with that financial insecurity and having multiple conditions, and with those conditions comes more than often prescriptions. So they have a much higher prescription cost. And then, dealing with it. So there's a lot of obstacles that this demographic can be dealing with, right? So we just want to point that out. It really helps kind of gain perspective when you're talking to these members. So you can really know what they are going through and how you can potentially help them. That's the biggest advantage there. So, on the on the left side, you see that, well, again, we go through just some criteria of the DSNP, what it must do. So it's going to follow rules outlined by CMS. They have to have Medicare, Medicaid. Our DSNPs, they'll coordinate with both Medicare and Medicaid benefits. A lot of them do offer supplemental Medicaid and Medicare benefits, as we talked about. And I have some more slides coming up that you'll really see what that means. And then again, because we're Medicare Advantage, CMS does have some changes, and we'll talk about one big one regarding final rule that kind of gets updated. Seems like a lot more often recently, but CMS updates us basically on what those details are, what can and can't be done. And again, it usually involves special election periods, right? Which is again something we'll talk about here. I just want to go forward one more slide to show you some things about our DSNP population. So we talked about low income, right? We talked about chronic conditions of our DSNP population. So 86%, excuse me, are actually dealing with extreme poverty. And that's even, 150% below the federal poverty level, right? So just think about that. And 50%, they rate their health status as fair to poor. So that's half of this population. Like there's surveys being done. Half of them have basically said, their health is not great. And so that's also something to think about. And then again, we mentioned there are those that are younger than 65. Here's another, it's something that might be overlooked, but you have a lot of younger individuals that have a disability, and that's how they qualify for Medicare, right? So a lot of them, 39% are under 65, right? So a lot, they're in the community or group home settings. They're also dealing with other physical disabilities or even other, medical conditions that we don't often see that kind of affect the younger individual. So just wanted to kind of show you that the average income of a DSNP member is on average between 8,000 and 11,000 annually. So again, just, try to think about that again with all the costs they may have, right? So again, these are just key factors to really understand the demographic and why these plans have the rich benefits, and then again, how you can help in each of these situations. Okay, so here now we're going back to a state map, and I wanted to share this with you of the integrated full dual SEPs, right? And so you're welcome to take a picture of this. This is one of those picture-worthy slides. So just to go off of the dark blue, the first part of that. So these are states that, have the ability for any full dual to join a plan. Okay. So you look at that, there's not very many. You look at the Northeast area, or excuse me, just the East border of the country, starting from Florida, right? The light blue, these are UHC full dual members. So you see our chunk right here, Texas, but I think you guys had some questions about the state map or the country map and where these might be found. So this, you can definitely take note of that. You'll have some other limited SEP opportunities in the gray and the dark gray. And then on our light gray, again, these are where we do not have a DSNP plan available. I just wanted to share that with everyone here. Okay, and so moving forward, this is another really valuable slide. So this is going to show you our Star Plus MCO carriers and what counties they're in. So I'm just going to start from the top really quickly. I won't read all of them, but just so you can kind of get an idea of what this looks like. So in Bexar County, and when we say Bexar, there's also some surrounding counties. It's more like a San Antonio market. But let's say we have Atascosa, Bandera, Comal, Guadalupe, Kendall, Medina, and Wilson. So on the left-hand side of these two columns, you'll see the current contract. This is before 2025. So it used to be Amerigroup, Molina, and Superior. But as of September 1st, 2024, last year, now you see it's Community First, Molina, and United Healthcare. So that far right-hand side is where we are right now. And all of these going down are the current MCOs in those territories. So
Hey,
you can
Roed,
see,
so for
yes,
agents that are in other areas and their local marketing rep should have a slide just like this to share with them.
that is correct. If there's, um, again, we're not, just something to keep in mind, we're not in every single market as a Star Plus Medicaid provider, but we are, in many of them. I'll give you an example. If you look at line number 10, you see how it says Nueces County? That's going to be like the seat of the Corpus Christi market. So we actually pulled out of Corpus this year. We used to be there last year. And here's the reason behind it. I just bring this up just so you can know that the local management, United Healthcare, will definitely let you know. You can always reach out to them. And if anybody on this call needs help getting connected to that local support team, by all means, reach out to me, and I'll help you get connected to the right person. But the example on Corpus number 10, we used to be there last year, but CMS only lets you have a certain amount of Medicaid Star Plus contracts. So the number 8 is the maximum number. And you can see on this chart highlighted in the light blue. So we have 8. We have 8 full ones. So we actually traded Corpus to get San Antonio. We had never been in San Antonio in that space before. And the reason is because obviously the population, the market is larger. So we were high rated in every single market we had. And that's why they let us pick the maximum number, but 8 is the limit. So they said, hey, if you're going to go to San Antonio, you have to drop one. And unfortunately, that was the smallest market we had. So you're talking about 300,000 roughly population versus, over 1 million here in San Antonio. So just keeping that in mind, wanted to share that with y'all. But that's why you see some counties we're not in, some areas. But yeah, to your point, Luis, and to answer that, the leadership in that local area will let you know if they are an MCO. And just, if you need help finding that person, let me know. Okay, so let me move on to this. This is a great slide for you. So this one, I call attention to this. We talked about something called the Medicare Product Portal at the beginning of our presentation today. And this is going to be a tool that is specific to United Healthcare. But what it's going to let you do, you can see that top slide here that I've shared. Let me blow it up for everybody. And you can basically, again, find any state across the US. You can zero in and find even the county that you're looking for or the specific market. And then you can see all of the UHC plans available in those highlighted counties, wherever you picked. Okay. Then you can even sort by DSNP, by CSNP, or again, this means you can sort by the dual eligible plan. You can sort by the chronic special needs plans or regular just Medicare only. And then you can find exactly if there is a highly integrated plan available in that area. So really helpful tool. The way to get it, again, Jarvis is our go-to platform. So anybody that has access to that can get it. On the home page, at the top, there's a
Are you guys still hearing Roel? Or is it just me? I'm sorry, Roel. Hold on.